Please note that the information within this video series on the Mental Health and Wellbeing Act 2022 is not legal advice. We'd also like to let you know that the content in these videos has been checked and approved by the Victorian Department of Health's Legislation and Entities Oversight team. Hi, and welcome to Tandem's information videos about the Mental Health and Wellbeing Act 2022. I'm Jo from the Advocacy, Policy and Research team at Tandem. Tandem is the Victorian peak body representing the needs and interests of family, carers and supporters of people experiencing mental health challenges. We advocate for improved services and policy change and enable family, carers and supporters to actively participate in mental health reform. Tandem has produced 4 short videos about what the Act means for family, carers and supporters, and the people they support. In these videos, I give an overview of the rights and options that people receiving mental health and wellbeing services have, as well as the rights and options that their family, carers and supporters have. I'll also talk about the legal responsibilities that mental health service providers have, and I'll explain where to find further detail if you would like it. I'd like to acknowledge that the Tandem office where I am today is on the lands of the Wurundjeri people of the Kulin Nation. I want to pay respect to Wurundjeri elders past, present and emerging, and also acknowledge that sovereignty was never ceded. It always was and always will be Aboriginal land. I'd also like to recognise the wisdom within Aboriginal knowledge systems about relationality and social and emotional wellbeing. One of the positive additions within the Mental Health and Wellbeing Act is a statement of recognition of First Nations people and acknowledgement of the treaty process underway in Victoria. The statement of recognition enshrines commitments to First Nations self-determination in Victorian government health statutes for the first time. Many of the people watching this video will be experiencing a stressful situation. Also, distressing memories can come up when talking about the mental health system. Support for you is available, and we'd like to briefly mention a number of services in case you would like to reach out to any of them. On the slide here, we have the back of a postcard that Tandem made to let people know where to find various types of support and resources. The Tandem support and referral line is in the mustard coloured bubble. This is a phone service staffed by people who themselves support people in their lives with mental health challenges. They provide information, advice, non-legal advocacy, system navigation and referral, and support with the NDIS. It's a free service available 9 to 5, Monday to Friday, and their phone number is 1800 314 325. The Mental Health and Wellbeing Connect Centres are mentioned in the blue bubble. The Connect Centres, as they're known, were recommended by the Royal Commission into Victoria's mental health system and opened in mid-2023. And they've been set up to provide a range of supports specifically for family, carers and supporters of people living with mental health challenges or substance use challenges. The Connect Centres provide supports such as non-legal advocacy, counselling, peer support groups and financial assistance. Most of their staff also have lived experience as a family member or supporter of someone with mental health challenges. I'll also mention carer consultants and family care peer workers. Many clinical mental health services, such as psychiatric units in hospital as one example, have one or more carer consultants and or family care peer workers. Their roles can vary, but generally speaking, they can provide information, advocacy and help to link you in with other types of services. As not all clinical mental health services have a carer consultant or family care peer worker, it's good to know that you can also ask to speak with a social worker. I also want to mention that the staff team as a whole at any mental health and wellbeing service has a responsibility to appropriately include and support family carers and supporters. This should be a core part of what they do. And all the services on this slide here should also be able to help if you have any questions from watching these videos and you'd like to know more about what the topics we touch on might mean for your situation. It's important to note that none of these services are crisis services. So on the next slide here, we've included the phone numbers for crisis support lines, including Lifeline, Suicide Line, Kids Helpline, and 13 YARN. If someone's life is in immediate danger, however, please call 000. You may well have found this video you're watching now via Tandem's webpage about the Act, but in case not, I'll mention that this webpage contains many different information resources, including from the Victorian Department of Health and various mental health organisations. The webpage address is www.tandemcarers.org.au/MHW Act. The webpage has a copy of these slides about the Act, as well as a list of the topics in each of the 4 videos, and of course all the videos themselves. It also has a written transcript of each video. You can also find our information kit about the Act, which is a collection of information sheets about various aspects of the Act and what it means for you and for the personal people you support. The information kit covers the topics we discuss here in this video series. Our Act webpage also has a list of answers to questions about the legislation that family, carers and supporters have asked Tandem. And there are recordings of presentations from organisations about their work and the Act, including from the Mental Health Tribunal, the Independent Mental Health Advocacy, IMA, and the Mental Health and Wellbeing Commission. I'll start with a brief overview of some of the reasons why it was decided we need new mental health legislation in Victoria. The Royal Commission into Victoria's mental health system found that the focus of the Mental Health Act 2014 was too narrow, as its main purpose was about allowing compulsory assessment and treatment. Unfortunately, this contributed to the current mental health system's crisis-orientated approach, rather than promoting good mental health and wellbeing. The 2014 Act did aim to promote supported decision-making and recovery-orientated practice. However, as we know, this has not been widely embedded into service delivery on the ground. Overall, the 2014 Act did not represent the gold standard in promoting and protecting human rights. The Royal Commission also found the 2014 Act did not promote robust oversight and governance of the mental health system, and that accountability mechanisms from the system to the service level were not clear enough. Another issue the Commission noted was that the 2014 Act was not implemented well at the time. In particular, there was a lack of education for consumers, family, carers and supporters, and the workforce about it. The Mental Health and Wellbeing Act 2022 took effect on September 1st, 2023. It responds to Recommendation 42 of the Royal Commission, which stated that Victoria's Mental Health Act of 2014 should be replaced with a new Mental Health and Wellbeing Act. Here on the slide, we have the first part of Recommendation 42. There is much in the 2022 Act that is similar to the 2014 Act. However, there are some differences, some important and positive changes for family, carers and supporters, and for the people they support. An example of these changes are the improved objectives and rights-based principles that underpin the 2022 Act. These outline what the Act is aiming to do and the sort of change it should contribute to. The objectives and principles are intended to reflect the Royal Commission's aspirational vision for a transformed mental health and wellbeing system, in which the dignity and autonomy of people experiencing mental health challenges are promoted, and the preferences and views of consumers, family, carers and supporters are a priority. As we go through them in a moment, you may be struck by the difference between the new objectives and principles and what the reality on the ground often is now, and how far we have to go to close those gaps. Achieving the objectives and principles in practice will, of course, require significant and sustained improvements across the system. And as we know, these improvements will depend upon many different things, such as culture change in mental health services, the workforce shortages being addressed, and ongoing political will and funding to make sure that the Royal Commission's recommendations are properly implemented and sustained over time. At Tandem, we feel the objectives and principles are very positive, and solid progress towards them could make a real difference to family, carers, and supporters, as well as consumers. And because they set out a clear direction, by explaining what the government and mental health system should be working towards, they're useful when undertaking advocacy at both an individual and systemic level. So, looking at the objectives first. On this slide, we have the overarching purpose of the Act and some summarised examples of more specific objectives set by the Act. This set of objectives is what it is hoped the mental health and wellbeing system will achieve. They provide important context on the main purpose of the Act and can help to understand the aspirations for the system. As you can see here, they're introduced by stating that the Act is striving towards the highest attainable standard of mental health and wellbeing for the people of Victoria. So accordingly, the Act aims to promote conditions in which people can experience good mental health and wellbeing and recover from mental illness or psychological distress. More specifically, it aims to promote equity in access to and the delivery of mental health and wellbeing services, and aims to promote services that are comprehensive, compassionate, safe, and high quality. Section C at the bottom of the slide there contains a list of subsections, which is very briefly summarised here on the slide. These subsections talk about the need for services to be accessible, responsive, and culturally safe. They also state that services should promote the rights and dignity of people living with mental illness, as well as continuous improvement in quality and safety. The importance of early intervention is mentioned, as well as the need for mental health services to be coordinated with other services, such as alcohol and other drug services. Also of great importance within Section C is the intention for compulsory assessment and treatment and seclusion and restraint to be reduced, and for seclusion and restraint to stop being used completely within 10 years. We've put the objectives that specifically mention family, carers, and supporters in blue text in these slides. So Objective D is to promote continuous improvement in the quality and safety of mental health and wellbeing services, including by ensuring that the experiences of people living with mental illness or psychological distress and the people receiving treatment, their carers, family, and supporters are at the centre of changes in practices and service delivery and the design and evaluation of systems. The next two objectives recognise the importance of protecting the human rights and dignity of consumers, about assessment and treatment being provided in the least restrictive way possible, and about consumers being heard. I explain a bit more about this in videos 3 and 4. Objective G is to recognise, promote, and actively support the role of families, carers, and supporters in the care, support, and recovery of people living with mental illness or psychological distress. And Objective H is to promote and support the health and wellbeing of families, carers, and supporters of people living with mental illness or psychological distress. Objective G is about the importance of services appropriately involving family, carers, and supporters. This is often referred to as family inclusive practice. If services do not listen to or otherwise exclude families, carers, and supporters, this can mean that very important information isn't shared, which can lead to poor outcomes. We'd like to acknowledge that these kinds of situations can be enormously stressful for family, carers and supporters. If everyone is able to work together, however, this can help the service to be effective for the consumer and helps their family, carers and supporters to provide support. Family inclusive practice is important for the well-being of family, carers and supporters as well. The Connect centres, which I explained about earlier, make a great contribution towards Objective H, which is about supporting the well-being of family, carers and supporters. But it's also important for services throughout the mental health and wellbeing system to have the well-being of family, carers and supporters in mind. And this brings us to the last two objectives. Objective I is about recognising and valuing the critical role of the system's workforce and supporting and promoting the health and well-being of members of that workforce. And Objective J explains that the Act aims to promote the mental health and wellbeing principles being put into practice on the ground. And that brings us to the end of our first video. In our second video, I'll discuss the Act's mental health and wellbeing principles and what they mean for consumers and family, carers and supporters, as well as the Mental Health and Wellbeing Commission. I'll also discuss what the Act says about information sharing between the mental health system and family, carers and supporters. Thanks for watching.